Hello viewers, this is Dr. P. Mary Anupama, faculty from the Department of Biochemistry, St. Joseph's College for Women, Visakhapatnam. Today, let us study about kidney function tests. Main function of the kidney is excretion of water, soluble waste products from our body. It does the functions of filtration, excretion and secretory functions. Impairment of any of these would lead to accumulation in the body or loss of some vital nutrients from the body. Based on the level of these excretory products and nutrients in the urine as well as in blood, we can make an accurate calculation of the efficiency of the kidney or functioning of kidney. Components of kidney function tests. These are of two categories. So we have tests that measure glomerular function and tests that measure tubular functioning. List of few kidney function tests are as below: urine examination, serum urea, serum creatinine, blood urea nitrogen (BUN), calcium, phosphorus, protein, albumin, creatinine clearance test, urea clearance test, INULIN clearance test, dilution and concentration test, serum electrolyte levels. Urine examination. The color, order, quantity, specific gravity, etc. of the urine is noted. Microscopic examination of urine is done to rule out any pus cells, RBC cas or crystals presence. These provide excellent clues to the nature and location of the lesion in the renal system. Second test is serum urea. Urea is the end product of protein catabolism produced by urea cycle. It undergoes filtration at the glomerulus as well as secretion and reabsorption at the tubular level. A rise in the level of serum urea is a marker of renal dysfunction or glomerular dysfunction. Urea level only rises when the glomerular function is reduced below 50%. Normal serum urea level is between 20 to 45 milligrams per deciliter, and this level it can vary based upon the dietary intake of the protein. And urea, it is measured by UV kinetic method using ketoglutarate as the ammonia acceptor in the presence of the enzyme glutamate dehydrogenase. It is also measured colorimetrically by Berthelot's endpoint method and is read in visible range using a colorimeter. Next one is blood urea nitrogen or BUN. Here the molecular weight of urea is 60 and we know that it consists of 2 nitrogen atoms and the combined molecular weight of it is 28. Hence, the contribution of nitrogen to the total weight of urea in the serum, if you find out, it is 28 by 60, which is 0.47. Hence, the serum urea levels can be easily converted to the BUN by multiplying it with 0.47. So the rise in blood nitrogen level, it is known as azotemia. So we find out the blood nitrogen level, then try to estimate the urea level. Estimation of calcium. Calcium in blood alone is measured in this test. Calcium as such is required to build and fix the bones and the teeth functioning, nervous system functioning, muscle contraction, even blood coagulation. It is required even for the heart to beat. The calcium test screens for problems with the thyroid glands or kidneys. Certain types of cancers and bone problems, inflammations of pancreas, which is called as pancreatitis, and kidney stones, there you have different levels of calcium. The normal range of calcium is 8.5 to 10.2 milligrams per deciliter of blood. Estimation of phosphorus. It makes up to 1% of person's total body weight and it is required to build and repair the bones, teeth, it helps nervous system to function, it makes muscles to contract. Kidneys are the organs which regulate blood phosphorus levels. Excess of phosphorus is filtered and is let out through urine. The importance of phosphorus is its utilization of carbohydrate and fats and protein synthesis during growth, in maintenance, in repair of cells and tissues. High levels are seen during severe kidney diseases or severe dysfunctioning of their calcium regulation. Excess phosphorus combines with calcium to form deposits in soft tissues such as muscles. The normal level of this phosphorus in the standard range, it is not available. Estimation of protein. Protein, if it is seen in urea, you call it as proteinuria. Proteinuria is found in nephritic syndrome where the loss of the protein is more than 3 to 4 grams per day and this can lead to hypoproteinemia. In renal diseases wherein you have this nephritic syndrome, the urinary protein excretion rate it would be 1 to 2 grams per day. Despite loss, liver maintains protein concentration and it does it if the loss is less than 3 grams per day. If it is more than 3 grams per day, even liver cannot maintain it. Serum creatinine levels. Creatinine, it's a small tripeptide which we find in the muscles and it stays in the muscles in the phosphorylated form and releases energy for muscular activity. It is released from the muscles during regular wear and tear and is converted to creatinine. Creatine is converted to creatinine. It's internal anhydride. Creatinine is not a toxic waste as it is freely filtered by glomerulus and little is secreted by tubules. It is simply used as a marker for renal functioning. Issues of glomerular filtration leads to substantial rise in serum creatinine levels. The normal serum creatinine levels are 0.6 to 1.5 milligrams per deciliter. Exception in creatinine levels. This is seen in people with more muscular activity, in bodybuilders or athletes. They'll have high creatinine levels. In case of any muscle trauma or excessive wear and tear as seen in athletes and people involved in hard physical labor, there they have this high creatinine levels. It is measured in laboratories colorimetrically by Jeff's method. Urea clearance test. Urea clearance is the hypothetical amount of blood from which kidney clears urea in 1 minute. This is determined by measuring the concentration of urea in blood, in urine and amount of urine excreted over a duration of 1 hour. Urea clearance is less than its glomerular filtration as some of the filtered urea from the glomerulus is reabsorbed at the tubules. To measure urea clearance, first the patient is made to void urine and then made to drink 2 glasses of water. Then the urine is collected after an hour and the blood specimen is also collected at the same time. Then the patient's urine sample is collected after another hour. The urea level in the 2 urine samples and the blood sample is measured. The urine volume is calculated as urine output per minute. If the urine output is more than 2 ml per minute, then the urea clearance is measured using this equation: urine urea concentration into urine volume per minute by urea concentration in serum. And if the urine output is less than 2 ml per minute, then urea clearance is measured using the below equation: urine urea concentration into square root of urine volume in ml per minute by Urea concentration in serum. Maximum urea clearance of any average individual or body surface area of 1.73 square meters is 75 ml per minute, and a standard urea clearance is 54 ml per minute. A urea clearance below 60% of standard is considered impaired. Creatinine clearance test. Creatinine is filtered at glomerulus while its reabsorption is very less. Hence, it is used to measure glomerular filtration rate. It is measured over a period of 24 hours. Urine is collected over a period of 24 hours and blood sample is also collected. The concentration of creatinine is measured in both the samples, that is in the urine sample as well as the blood sample. Creatinine clearance is measured by using the following equation: concentration of creatinine in urine into volume of urine by concentration of creatinine in serum into 1440. The normal range of creatinine clearance in males is 100 to 120 ml per minute. In females it is 95 to 105 ml per minute, and this is very close to glomerular filtration rate. INULIN clearance test. To use any substance for measuring glomerular filtration, the molecule should have some features, like it should be non-toxic, it should not be metabolized in the body, it should be completely filtered at the glomerulus, it should neither be secreted nor reabsorbed at the tubules, and INULIN, it has all these features. Inulin is a small polyfructosane molecule and it meets all the criteria mentioned for measuring glomerular filtration rate. GFR, it is glomerular filtration rate, and GFR is the amount of blood that passes through and is filtered through the glomerulus in a minute. Protocol for measuring GFR using inulin. Inulin is introduced into the blood by means of slow continuous infusion to maintain steady concentration of inulin in the blood. This is done by first infusing 30 ml of 10% inulin in 250 ml of normal saline, and it is infused at a rate of 20 ml per minute to achieve the desired concentration. Then 70 ml of 10% inulin in 500 ml saline is infused at a rate of 4 ml per minute to maintain the desired concentration. The patient is then asked to micturate 20 minutes after the second infusion. The urine is discarded and the time noted. After exactly 60 minutes, take another sample of urine and blood is collected. Then measure the volume of urine and the concentration of inulin in both serum and urine. Thereafter, the inulin clearance is measured by using the formula concentration of inulin in urine into volume of inulin by concentration of inulin in serum. The normal inulin clearance is 120 to 130 ml per minute for an average person with a body surface of 1.73 square meters. Variation indicates impaired glomerular functioning. Concentration tests. The first 3 urine samples passed in the morning are collected and their specific gravity is measured. In a normal person, the specific gravity of at least one of the samples should be above 1.025 or above. If the specific gravity is below 1.025, then it is a sign of tubular dysfunctioning. This is a measure of the ability of the kidney to conserve water and concentrate urine, and is a measure of tubular functioning. Dilution test. In case of fluid overload, tubules absorb less amount of water and hence leading to excretion of diluted urine. And the protocol for this test is like this. The subject is put on overnight fast, and then in the morning the subject is made to drink at least 1.2 liters of water over a period of 30 minutes. Then the urine samples are collected every hour for 4 hours. The specific gravity is measured, and here at least one of the samples should have a specific gravity of 1.003 or less. Deviation of this sign indicates again tubular dysfunctioning. Electrolytes test. One important function of kidney is electrolyte balance, and most of the electrolytes of blood are filtered at glomerulus but are reabsorbed at the tubular level. Problem at tubules is it can lead to excess loss of electrolytes through urine if tubules are at problem. So the serum electrolytes that are measured for this purpose are serum sodium levels, which should be between 135 to 145 millimoles per liter, serum potassium levels, which should be between 3.5 to 5 millimoles per liter, serum chloride levels, which should be between 95 to 105 millimoles per liter. With this we have completed the kidney function test. So one simple advice is take at least 5 liters of water. Thereby you can keep the kidneys healthy and we can stay healthy. Thank you for watching this video.